Just wondered if we can talk a little bit about the plan on a local level. I know we've got our Pfizer vaccine is here. We're rolling out inoculations for 80 plus, 80 years old and plus right now, and that seems to be going fairly well. Maybe you can just give us an update on that local plan and sort of where you see it going from here, if you don't mind.
Sure. Well, thanks for that question, Ray Latham. And as we mentioned in the last segment, this vaccine is, I think, what's really our hope for stopping this pandemic. I've been involved in public health for a number of years now, and have had more than one experience with using a vaccine to stop an outbreak. The most memorable one for me is an outbreak of meningitis that was killing teenagers, otherwise healthy teenagers in Ottawa back in the 1990s. And we went in with vaccine, immunized 152,000 children and adolescents, and that outbreak stopped. And I'm hopeful that we'll get the same effect with these vaccines. Now, we're lucky to have 4 different vaccines licensed, and at this time, 3 different vaccines available. But the vaccines are different in how they work. They have different mechanisms, and they have therefore different ways that they need to be handled and managed. The first 2 vaccines that came along were, as you mentioned, the vaccine by Pfizer and the vaccine by Moderna. These are a new how should we put this? The technology actually isn't brand new. They've been using it for a number of years in research for cancer therapies. It's where they use some messenger ribonucleic acid, mRNA, that kind of codes for the proteins that our immune systems need to be able to respond and provide the backup. But the problem with these vaccines is that because this mRNA is so fragile, lots of things can make it disintegrate, like being shaken too much or not being kept frozen. And so it's difficult for family doctors and pharmacies to have these frozen, the ability to keep these vaccines frozen. This happened actually a few years ago when we got the very first shingles vaccine. It was called Zovirax, and it was also stable only in freezers. And it meant that doctors' offices couldn't easily manage it, because not every doctor's office has got a freezer that can go down to -20. So we're kind of in the same situation. So those really have to be handled by people with that freezing capability, like the hospitals, like local public health agencies. And so we're using these vaccines in the various mass immunization clinics and hospital clinics that have gone, that have been set up. And I'm happy to tell you that we're working through this and have got several clinics up and running, and people can book now. You mentioned it's 80s and over. Well, actually, the province has gone to 75. So if you were born in 1946 or older, beginning today, people in our area can book at 3 places, and there are going to be more as time goes on. But right now, there's 1 clinic going in each of the municipalities that you mentioned. The one in Kawartha Lakes is at the Lex, as people know. And there's going to be ongoing clinics. The Ross Memorial Hospital, who are terrific partners, have actually taken this on and are running it for us till the end of June. And we'll just see where we are at that time. I hope everybody will have had their first dose by then. In Northumberland County, we've got clinics going on at the Coburg Community Center. Right now, family health teams are doing their own patients there. We wanted to get vaccine out to whoever was ready. But starting on Thursday, people will be able to book if they're 75 years of age and over. And in Haliburton County, we've got the Haliburton Family Medical Center who's providing it as well. So there's something going on in each of the municipalities, and we're in the process of getting a memorandum of understanding to set up probably at least 1 more in each of the municipalities. Some of those will not be going until the first week of April. And there's a couple of reasons for that. The most important is this, as I mentioned before, the supply of vaccine. As people have heard of the news, I think the government of Canada was very disappointed that while they made the orders, there is delay in delivery. And we've been getting, I would describe it as modest supplies of vaccine. And and also the vaccine that can only be used in certain ways if it's only stable in the freezers. So we've been getting, it depends upon the week. Some lately we've been getting a few more doses, like around 6,000. Most of those are going to be going to retirement homes. People need to also understand that the government of Ontario has set up a priority list, and so to go through the priority list and get the highest done, and then others as we go down the list of priorities. So healthcare workers is on the list. The long-term care homes, you mentioned that we've had no meaningful outbreaks for the last couple of weeks, and I'm almost certain it's because we've got 2 doses of the vaccine into that group. So yes, we'll be going through that list. And as I said, this week, the retirement homes, there are others that need to get this. There is one little glitch that people need to know about, and that is that to give everybody a fair opportunity to get vaccine in the first instance, the government has decided now that it's allowed to give everyone the chance to get their first dose, because before people are getting their second dose. Now, the exceptions to that are elderly people, both in long-term care home and on First Nations communities. So those are getting their 2 doses, but everybody else is. I don't care if it's healthcare workers or people on home care and so on. Everyone's getting their first dose first before they go to the second dose. And there's a reason for that. First of all, the first dose does provide a good level of protection, not 100%, but pretty darn good. But the other thing that it does is it means that if we've got many people who have got some protection, that actually raises the protection of the whole community, and the virus can circulate less, which means there's fewer cases, fewer people with complications, and fewer people who need to go into hospital. So it's not just an individual strategy. And people say, well, I want my second dose. You'll get it. It's just not the spring. It'll be probably into the summer. But having everyone getting their first dose means that the whole community is protected. And therefore, I do support this approach very much.